Let's get you up to speed of the latest developments in the coronavirus pandemic. The total of confirmed coronavirus cases worldwide has now surged past 50 million, following record numbers of new cases in several countries, including Russia and Brazil. The US has the most cases, with nearly 10 million people testing positive. It's reporting more than 100,000 new cases a day over the last week. And Argentina has signed a deal with drug maker AstraZeneca to deliver around 22 million doses of vaccines. The aim is for the vaccines to be available in the first half of next year. To Belgium now, where the healthcare system has been in crisis mode for days, with COVID patients being transported across the country and even abroad to find available intensive care beds. Marina Strauss and Rosie Burchard report.
The start of a journey that could help save lives. This Belgian COVID-19 patient is about to be transferred to a hospital in Germany.
First patient for today is quite easy for us because he's not intubated, he's not sedated, so he's breathing, but we have to monitor everything. Heart pulse, so cardiac frequency, blood pressure, the consciousness of the patient and everything. So that's a little bit challenging in such a small helicopter.
59-year-old Freddy needs intensive care support. With the wards filling up here in Liège, he volunteered for transfer to Münster in northwest Germany, because he can speak German.
Wie geht's?
How are you? I'm fine, thank you. During transport, Freddy wears a breathing mask. This plastic covering is meant to protect him and everyone around him. Belgium has become the epicenter of Europe's second coronavirus wave. Liège, in the French-speaking part of the country, has been hit especially hard. There are too many sick people and not enough beds. Doctors here fear they'll soon have to decide who will get treated and who won't. We are European countries and we normally have all we need to save patients. We don't want to do worse than we usually do. At the moment we're still managing, but our biggest fear is that in a couple of weeks we'll no longer be able to cope. To help prevent such a situation, Belgium has asked Germany to take COVID-19 patients like Freddy. At the moment, infection rates are much lower in Germany than here in Belgium. But the situation is unpredictable and could change at any time.
We are very happy that we can help. At this moment in time, we still have capacity. In Belgium, capacities are nearing the possibility. So good that we can help now. And as I said, perhaps in the future, Germans have to come to Belgium. So it's all a question of European solidarity. It's good neighborhood and it's really close cooperation.
In just over an hour, Freddy and the crew will have arrived on the other side of the border, providing some relief for the hospital here in Liège, which is now able to take in another COVID-19 patient.
Germany is marking 1 week since authorities tightened restrictions on public life for a second time to fight the spread of the coronavirus. Bars and hotels are shut, restaurants are open for takeaway only, but schools remain open. DW had a look around Berlin to see how people are handling the situation.
Berlin Alexanderplatz. In the popular areas for shopping and strolling, a safe distance is not guaranteed, say the politicians. That's why there are compulsory masks, even outside.
Das finde ich grauenvoll.
I find it terrible. Why should I put on a mask out here now when nobody is walking behind me? You have to be able to breathe fresh air. I do not find it okay that the mask has to be put on in certain places, because I mean that, it's really the outdoors. What is actually that supposed to happen there? In public buildings, I understand, metro, train, everywhere, but not here in a public square. Do politicians need to explain more clearly what they're doing to combat the pandemic? The whole thing doesn't only depend on the politicians. The whole thing here is a social duty like many others. In a democracy, all people have to support it in some form or another. In the long run, we will have to live with this virus somehow, and we actually need a social debate, how it's going to look exactly. If we compare the situation in Germany with other countries, then we're relatively okay. Don't talk so much, something has to be pushed through now. We have to look at the end of the day to see what happens, which indicates that the measures are the right ones. Or what comes out at the end. Will it go on like this? Will the wave get higher and higher? Then of course one has to ask the question, what do we still have to do? Doing even more. Hardly possible for the restaurants and cafes in the capital. They have to close for a month, again. This can be seen almost 5 kilometers away in the trendy district of Friedrichshain. There are usually hundreds of people in this pub district, tourists but also Berliners. Berlin needs these security measures to put down the virus and disease. I work in the hotel business myself, and my hotel is also closed. Yes, c'est la vie. As long as it's only till November, it's fine.
November ist, dann ist in Ordnung.
I think everyone who is not affected is fine with it. So I don't have any big problems to do without now, for a while. But also only because I don't work in the hospitality industry and have nothing to do with it. I can understand that people are angry or insecure and that it directly affects them professionally. At the same time, most restaurateurs have invested a lot of money in hygiene measures. Some offer food to go to earn at least a little money.